The best way to treat sleep apnea is with CPAP therapy. However, CPAP therapy may not be an option for some people, whether due to financial strain, certain health conditions, or an inability to tolerate their therapy. If this is the case, there are a few alternative therapies outside of CPAP for these patients to consider. I should note that before trying any alternative therapies, you should always speak with your sleep specialist about how best to handle your particular condition. But with that in mind, let's take a look at some common CPAP alternatives. Hi, I'm Dr. Joe Cranen. If you have sleep apnea, but you're unable or unwilling to use CPAP, or you've tried CPAP and it just hasn't worked out well for you, you may be a candidate for alternative to CPAP treatments. Let's explore some of these options. First, let's look at some lifestyle changes that you can make starting today. Weight is very much linked to obstructive sleep apnea. Losing weight can help a lot. In some rare cases, you might even be able to beat your obstructive sleep apnea with enough weight loss. Another important thing, watch your alcohol intake, especially near bed. If you're gonna drink, try to keep it away from bedtime. Muscle relaxant medications, sedatives, hypnotics, all of these things can exacerbate obstructive sleep apnea. Smoking. The smoke from cigarettes and other materials can irritate the inner lining, the epithelium of your upper airway, causing fluid to move in, which narrows the airway and makes it more prone to collapse. So working on smoking cessation is also extremely important. What about sleep hygiene and sleep positions? One thing that you can do is try to avoid sleep deprivation. If you get sleep deprived, you're gonna go into deeper sleep and your body is less likely to wake up from the damaging effects of sleep apnea. So it can exacerbate the effects of sleep apnea. Let's talk about sleep position. Sleep position, we're really talking about gravity. How can we mitigate the effect of gravity on your upper airway? Number one, staying off of your back can help. Number two, raising the head of the bed, 15, 20 degrees, somewhere in that range can also help. Next, we'll talk about alternatives to CPAP. Mandibular advancement devices, or MADs, are the most commonly used subset of oral appliances for sleep apnea. They are retainer-like devices that cover your upper and lower jaws, and they push your lower jaw, your mandible, out, opening up space primarily in the retrolingual area behind your tongue. Tongue retaining devices are another type of oral appliance for sleep apnea, less commonly used than mandibular advancement devices. These are suction bulb-like devices that you pull your tongue into, and there's a flange that sticks out in front of your lips, and it keeps the tongue held forward and helps to maintain the open space behind your tongue. In terms of what's the most effective alternative to CPAP therapy for OSA, I would have to say oral appliances for sleep apnea. Now I'm talking about the prescription ones that are FDA cleared for mild to moderate obstructive sleep apnea, not the over-the-counter ones that you can buy on Amazon or at pharmacies. The caveat is that these devices need to be fitted properly and adjusted properly. They need to be slowly advanced out over time. And to do things right, you should have a follow-up sleep study with the oral appliance in to confirm that it is effectively treating your sleep apnea. In summary, we've talked a lot about alternative to CPAP treatments for sleep apnea. As a reminder, CPAP is the gold standard. Clearly, it is the best treatment. However, if you're unable or unwilling to use CPAP, or you've tried it and you failed it, the good news is that there are a lot of other options out there for you. Talk to your doctor or go to sleepapnea.org to learn more. Thanks for watching.